But first, though, the fight against coronavirus involves all of us, from politicians to doctors, and one of the few people who straddles both of those worlds is Labour's Shadow Mental Health Minister, Rosena Allin-Khan, who continues to work as a frontline A&E doctor. She joins us now. Thank you for being on the programme. I know you've been doing some shifts in the Nightingale Hospital in London. What's the situation been like most recently?
The staff there are absolutely incredible and are a committed team. And this week on my shift, I was working with the family support liaison team. And it really gave me the insight to see how this virus has been stripping families of the ability to grieve, of humanity. And the setup that they have at the Nightingale is phenomenal. We spend the day phoning patients' families, and I've been a doctor for many years, but there is nothing more heartbreaking than delivering the very worst of news over the phone. And on some occasions, we are able to bring a family member through to say goodbye, but we're only allowed to bring one person in. And imagine now, for a family, having to decide who is that individual that is able to go in and say goodbye, accompanied by a member of the team like myself. That is a crippling decision to make. And I found myself coming home heartbroken and asking myself, how much of this could have been avoided?
You say how much of it could have been avoided. What do you mean by that?
I understand that this is a global pandemic. It would have been impossible to save all the lives that we've lost. But we did enter into lockdown too late. We did not deliver PPE to the front line when it was needed. We did not follow global advice on self-isolation, and we haven't rolled out mass testing and contact tracing. So when I find myself in the unenviable position of not being able to hug someone as they cry after they've said their last goodbye, it makes me think, how many of these grieving families could have not had to be in this position? And fundamentally, we are going to have real mental health issues to deal with for these grieving families, but for the NHS workers who have had to hold their hand through this process.
I mean, it's a big statement to make. I guess the government would argue that actually they are really ramping up testing now. They've been surprised, if you like, how many people have followed the lockdown, and if it had been done earlier, that may not have happened. And also, I suppose, too, it's incredible, really, how similar the number of deaths have been across other European countries, which perhaps doesn't necessarily chime with the fact that we've done too much worse than elsewhere.
I think we should always compare ourselves to the best, not the average. And when you look at other countries like Germany, there have been far fewer deaths. They got on top of this much sooner with testing and contact tracing. And I firmly believe that, yes, the government have made grand promises of 100,000 tests by the end of April, but we have to be clear that that is delivered on and not simply a promise. We can't just be talking about capacity. It has to be tests delivered. But are we too late? We are 3 months in to having had our first case. And fundamentally, it is heartbreaking to see how many people can't even be at the funerals of those they love the most. People have been robbed of the opportunity to say goodbye in a humane way. And NHS workers haven't been able to comfort grieving families in the way that they would have been able to normally. But you know, I am really proud of the British public. They have been phenomenal in following advice. And I think the fact that we are seeing cases come down is testament to the resolve of our communities. But the government also need to be recording the numbers of deaths in care homes and in the community, as well as hospital deaths, because we won't know whether we are fully on top of this and whether lockdown measures have been working as well as they can be until we are recording all of the deaths.
As you say, it does feel as if cases have started to come down according to the official figures. I just wonder if that's been your experience working in A&E on the front line. I mean, there have been reports as well that the Nightingale Hospital in London has been largely empty.
Look, I've been working at St George's in Tooting. That's where I work in the A&E. In the Nightingale, obviously, it's an intensive care set up. But in the A&E departments, my colleagues and I have been finding that the number of patients, worryingly, is going down for other illnesses. My plea to anybody watching your show today, Sophie, would be if you have chest pain, if your child is ill, if you are worried that someone you love have got symptoms of a stroke, please, please go to the emergency department. We are ready and waiting for you. We don't want to see a rise in deaths come out of those people who were too afraid to go to hospital because they were worried about contracting COVID-19.
Yeah, there's certainly been some concerning reports about cancer treatment being delayed, A&E attendance dropping. Do you think at some point there might be a tipping point where actually there is a risk of more deaths effectively being caused by the lockdown than by coronavirus itself?
I don't think the deaths will be caused by the lockdown. I think the deaths will be caused by people being too afraid to go to emergency departments and having had their cancer treatments delayed. I think people want transparency. Our communities want transparency. Cancer patients want transparency. People need to know what is going on, when they can expect their treatment, when they might be able to have that long awaited operation. But people have to go to the hospitals if they are concerned that they are unwell due to something else that isn't COVID-19 related.
Keir Starmer has written to the Prime Minister calling on the government to publish its exit strategy. Now, in many ways, of course, calling for something to be published is the easy bit. The hard bit is, of course, working out those very difficult, finely balanced decisions about what should happen. So what does Labour think the exit strategy should be?
Labour isn't looking to have any sort of argument about what the exit strategy should be. We are fully supportive of the lockdown measures that are in place. What we are asking for is some strategy going forward, some idea, because when we look at our devolved nations, they have at least given the public some indication of how the easing of restrictions may look. I think, Sophie, so much of the uncertainty is really breeding people to be worried in our society. They are really, really worried because they don't know, is it going to be children going back to school first? You know, when are the elderly going to be able to leave their homes? What is this going to mean for their jobs? So what the Labour Party is calling for is some greater understanding and clarity as to what the exit strategy may look like.
At the same time, though, it's calling for something, as I said, is the easy bit. The hard bit is coming up with answers and solutions. So Labour doesn't have any opinion on that at all.
I am sure that Keir Starmer would be happy to be invited to have discussions with the government and draw up a plan of a positive exit strategy that works for all our
So what
communities.
should that be then?
This is about saying people need to have some understanding of what the easing of restrictions may look like. If you are someone who relies so heavily on mental health support, for example, because you have an addiction or you have an eating disorder and you can't go to your daily therapy programs, are you going to be someone who is able to do that in the first wave of easing restrictions? If you are a single parent and you are trying to homeschool two children, are children going to be potentially going back to school first? If you have loved ones that you really, really care for who are in a care home, like my father, am I going to be able to go and see him, or will we have to wait until next year? These are so many things that need answering for people to have positive mental health going forward, because the British public have shown incredible resolve. They can get through anything, but the government need to make it slightly easier to ease the pressure on people's families so that they understand what the easing of restrictions may look like. And that is what the Labour Party is calling for.
Well, we might get some of those answers sooner rather than later, with Boris Johnson returning to work from tomorrow, from Monday. Are you pleased to see the Prime Minister back?
Of course. I wish him well. We all wish him well. And we only want the best for him and his family.
OK, and just finally, you're in Keir Starmer's shadow cabinet. You also served under Jeremy Corbyn. How are the two men different in their leadership styles?
They are two men full of integrity, a love for the Labour Party and a desire to make our country fair for everyone. Of course, they have different styles. I think any boss I've ever had in my life and any job I've had have had different styles. It was an honour to serve our Labour Party under Jeremy Corbyn, and it is an honour to serve under Keir Starmer.
So those are the similarities, but what are the differences then?
I think, honestly, they have different personality types. I think it was phenomenal to see Keir Starmer at PMQs this week. He was utterly forensic in his responses, and I think that was something that was really welcome. People have different styles, and I am really excited about the Labour Party going forward. But it was an honour to serve under Jeremy Corbyn, and I'm not going to sit here and compare one and the other. It was an absolute pleasure to serve under both.
OK, Dr. Rosena Allin-Khan, thank you very much and sharing your experiences at the Nightingale. Thank you.
Thank you very much.